Did you know ketamine, originally developed as anesthesia, was first discovered to work similarly to antidepressants as early as 1975? Early reports from street ketamine users showed promise in its antidepressant effects, but they were dismissed because it was an illegal substance. Researchers began studying it in humans in the late 1990s, with a first study published in 2000 that showed promising results for ketamine infusion therapy. In 2019, S-ketamine, known as ketamine, was approved by the FDA for treatment-resistant depression or major depressive disorder. However, this is more common than you would think, with more than 50% of people that don't respond to antidepressants at all, meaning that ketamine infusion therapy might be the solution for people who do not respond to at least 2 different antidepressants. In this video today, we will be discussing ketamine infusion therapy and how it can save lives in regards to people who suffer from either PTSD or major depressive disorder, and how it can be used if patients do not respond to first-line antidepressants. What's up? This is your daily dose of mental health. Please like and subscribe to this channel. I love you all. Let's jump right on into this, and I hope you enjoy this video. Now, before I talk about ketamine therapy, let's talk about a few of the prerequisites to qualify for it. First, let's review what a selective serotonin reuptake inhibitor is, known as an SSRI. These are antidepressants, and they are known as first-line treatments for depression or major depressive disorder. They increase serotonin levels by stopping neurons from reabsorbing serotonin. Unfortunately, not everyone responds to the same medications and can experience side effects. The good news, though, is SSRIs are just one option for treating depression, which typically this obviously is the first line for major depression disorder, as well as therapy you can try. If you're looking for alternative therapy, however, there is ketamine therapy, which can be used. But remember, before, you typically need to try at least 2 antidepressants first. So real quick, what is ketamine therapy or ketamine infusion therapy? Ketamine, which was initially used as an anesthetic, is now used in treating depression, anxiety, and PTSD. Ketamine therapy is administered as an intravenous infusion, which is FDA cleared. And also, it can be used as a nasal spray. It was cleared in 2019. Regardless of whether you have the IV or the spray, ketamine therapy works by stimulating a different part of your brain, essentially. You'll relax and receive your therapy in a comfortable private room. After 2 hours or so, a friend or family member can drive you home, as you still might feel sleepy. Side effects are temporary, and most people wake up the following morning feeling refreshed and with a noticeable improvement in mood. Also, typically you're going to get multiple treatments, and depending how you respond to the treatments, your dose will either increase or decrease. Now, real quick, before I go any further, please like and subscribe to the channel. Also, leave a comment if you've ever had ketamine infusion therapy or you're interested in it because antidepressants haven't worked for you, or you suffer from PTSD or anxiety. I'd love to hear from anyone out there who is at least thinking about it, or just leave a comment if you find this video interesting. I'd highly appreciate it. Okay, so what are some of the benefits of ketamine infusion therapy? If you've tried, once again, several antidepressants before, then you know that it takes typically anywhere from 4 to 6 weeks to start feeling the full effect of the medication. Sometimes even longer, sometimes in a week you can. Just depends on the psych setting. I've seen it as early as 6 days. I'm a psych RN, just depending on the medication. Typically also with SSRIs, you would start with something like Zoloft, and if that doesn't work, you go to a Prozac. Side effects or effects, some people see none, some people see a lot of them, and sometimes they don't see any help in antidepressants. So someone who is suicidal does not have the luxury of waiting several weeks a lot of times for a medication to kick in. That's the kicker with antidepressants. Real quick, also, in one study, 88% of participants given a ketamine infusion in the emergency room had their suicidal ideation go away, which is amazing. In just, here's the biggest part, in just 90 minutes. 90 minutes, their suicidal ideation was gone. I just wanted to throw that out there real quick. It is thought that ketamine infusions work by inducing the production of glutamate, which is a neurotransmitter in the brain. A lot of times, abnormal levels of glutamate have been linked with depression, abnormally high or abnormally low, actually. The glutamate leads the brain to form new connections and repair damaged ones, increasing its adaptability. Which, when you're going through depressive spells, a lot of times, when your brain's not adapting, and let's say you're staying in your room all day laying down, and there's no neuroplasticity evolving, that can lead to abnormal low glutamate levels, which can just make the depression even worse. The new neural pathways. Think of them as new roads in your brain, as I was saying, that allow you to create more positive thoughts and therefore behaviors. This is compared to traditional antidepressants, which only work as long as they are in your system. Symptoms that may improve include a depressed mood. Symptoms that may improve when getting the treatment include a depressed mood, suicidal ideation, helplessness, and worthlessness. So those are typical signs of somebody who is suffering from major depressive disorder, and even sometimes PTSD. So effectiveness of ketamine. Effectiveness of ketamine infusion therapy has been hailed as a transformative treatment because of its high rate of response. In one study, and this is a great study that I'll put the link if I can after it. In one study, 85% of patients experienced a remission in their depressive symptoms, which is defined as at least a 50% reduction in symptoms. However, ketamine infusions aren't necessarily a cure, obviously. Patients relapse, some symptoms returned on an average of 19 days after, but some do not relapse for more than 3 months. And this is a lot of times why when you have ketamine infusion therapies, you would start over a week of typically having, let's say you have six infusions over 2 weeks. So like every 3 days. And then from there, you would see how your depression or PTSD is improving. And then from there, you would go in maybe every 3 months to get an infusion. Also, things to consider. If you are thinking about receiving ketamine infusion therapy, you'll want to consider some of the side effects beforehand. As stated, not just antidepressants everything has side effects. Also, if you're dealing with a mental health condition, which is big, a pre-existing mental health condition, or you're using drugs, or you have a history of pre-existing psychosis, you might not be eligible to receive this kind of therapy. Let's also discuss some tips that might be helpful to you if you receive ketamine infusion therapy. Which, before that, let's talk about some of the side effects. Ketamine infusion therapy is delivered at a dosage that is less than you would get if you were receiving ketamine for anesthesia, but some of the side effects might seem similar. The good news is that typically they go away either by the time of the infusion, by the time the infusion is over, or within a few hours. So some of the side effects to prepare for, which are normal, and this is where a lot of times sometimes people will have a ketamine infusion have like the infusion, which I have a couple friends who have gotten it, and they're like, I don't want to do it again because it was, some hallucination, seeing things. all these different things, but sometimes you just have to prepare for them, which common ones are nausea, dizziness, double vision is big, drowsiness, and confusion. I wanted to tell everyone that because the confusion aspect of it, sometimes when people start feeling confused when they're getting this, and that's why you would always have a doctor there with you monitoring your vitals, your blood pressure, all your specific vital parameters. They do this because this can happen. So essentially, remember, if you have any pre-existing health conditions, in particular like psychosis, even somebody, if you have a history of schizophrenia in your family, this might not be for you because it could potentially cause a psychotic episode. Okay, so real quick, and now which leads into what I was just saying, who this isn't for. Although ketamine infusions may generally be well tolerated by many, there are several factors that might prevent you from being able to try ketamine infusions. For example, if you have, as I said, which I jotted down, schizophrenia, or a history of drug-induced psychosis, high blood pressure that is not otherwise well managed, or if you are acutely alcohol intoxicated. So that would be if you went in there and you're a chronic, if you've been using alcohol daily, you suffer from alcoholism, you will not be able to receive ketamine infusions. And this would be due to, with alcohol, with the changes in blood pressure and vital signs. The next real quick I want you to take into consideration, and this is kind of what I consider as the tips and tricks. If you haven't taken the first step by deciding to get ketamine infusion therapy for your mental health, here are a few things you can do to maximize your experience. So I jotted a few of these things down. You'll want to minimize your stress levels. Avoid anything stressful, like reading or watching the news before your treatment. You want to be in the best frame of mind before going into it. And this is what I'm talking about. This even goes with things as I made a video about how to approach if you get paranoid when you smoke marijuana, or even use a hallucinogenic, which ketamine technically is. If you're not in the right state of mind and you're feeling and you're going into this scared, you're going to have a horrible experience. So go into it knowing I might experience a lot of different feelings that I haven't felt before, but it's normal, and you're letting go. You're letting go of your depression. You're starting to let go of your depression or trauma or pre-existing conditions that have caused you to be depressed. Okay? Here's another tip. Find a good playlist. As I said before with anything, music. Find the right kind of music. This will help you relax and will set the soundtrack for your experience. Music without words is recommended. A lot of times just lyrics, like symphonies, like Beethoven's dun 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 ha 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 ba 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 ba, things like that. I know that was probably kind of weird how I did that, but finding things like that is hearing the lyrics to a song can actually be very distracting. So just no actual voice. Meditate. If you have this is another one, meditating. If you have a meditation practice, you may want to meditate just before starting the ketamine infusion to slow down your racing thoughts a little bit. Racing thoughts can lead to paranoia, high anxiety, which can make it where you won't want to go in and get another treatment, which then will just make your depression worse and you will down spiral even further. Another tip, integrate with therapy. And I'm a huge advocate for this. I've always said, even when discussing specific medications in the psych setting, always, it's never just a medication that will solve a problem. It's a holistic process, which nutrition, exercise, therapy. So if you are already in therapy, it would be helpful for you. It would be very helpful for you to discuss your expectations before and process your experience afterward with your therapist. So let them know that you're going to be going through this. They can give you tips as well. And also afterwards, if you had a bad experience, they can help encourage you. Or if you had a great experience, express how you're feeling. And also another good tip is journal after it, those feelings. And this goes even in general, if you're ever recounting even trauma or depression and anxiety, if you're ever currently having like an active anxiety attack, try to recount how you were feeling. Writing things down goes a long way. And I encourage this to patients I have in general, to write down your feelings, because it does help. I know it sounds cheesy sometimes, but if you do that, you'll notice you can actually learn to combat some things like anxiety or improve your mindset. Okay, so how to get started. If you're looking to start ketamine infusion therapy, this section that I'm going to be going over with you will help you find a provider and what you can expect at your first appointment. So really, how to find a provider for ketamine infusion therapy. If you've decided to take this step, you may be overwhelmed with where to begin to look. If you are in a major city, you may have many options, but how do you know which ones are legitimate? So then this is big. For example, I live in Kansas City. The American Society of Ketamine Physicians, Psychotherapists, and Practitioners directory is a good place to start. So I will put in the link, it's the ASKP, which is the American Society of Ketamine Physicians, Psychotherapists, and Practitioners, because it has a directory of, in major cities, the best places to go that are legit, because unfortunately there are fakes out there. So this would be a good place to start. Its members must agree to a strict set of standards and ethics, which would be monitoring vitals, making sure you're going into it and you don't have a pre-existing mental health condition like schizophrenia or things like that. Next, what will my first appointment be like? So I haven't had the therapy, but from what a friend told me is your first meeting will likely be, you'll have an intake session where the doctor will ask you about your depression, what you've already tried, and what medicines you are currently taking. This is where we talk about typically taking first-line antidepressants before actually going about this. Also, this appointment is also your opportunity to ask them questions. If they decide you are a good candidate for treatment and you feel comfortable with them, you will schedule your first infusion. This is where they'll go over what to expect, side effects, things like that. And real quick, typically the standard protocol involves about 6 infusions over the course of 2 to 3 weeks. And then you will check in with your doctor on how to proceed from there. So then you might go from there to having one every 3 months. Some people will go back roughly, as I said, monthly for booster infusions, and some will be considered in remission. So depending on the situation, you might not go back, but from what I've gathered, I won't give his name, but my friend, he goes back once every 3 to 4 months for a very low dose ketamine infusion. And the good thing is a lot of insurances cover it today. Your first ketamine infusion should last around 40 minutes. The provider will make sure that you are comfortable before you get started, and they will likely put a pulse oximeter on your finger and obviously get a blood pressure. So this is your vitals. So they can monitor your vitals during the infusion. They may offer an eye mask and headphones, which is key, the eye mask, or they may want you to bring your own. Some people find it more pleasant to have an eye mask on and listen to calming music, as we stated above. And also you may begin to feel some of the effects of the ketamine within a few minutes. You might feel a little floaty. It's like a floaty sensation, or you may feel like you are not quite in your body, where they say it's an out-of-body experience. This is all, and remember, this is all normal. And you could possibly mildly be dissociating, and this is part of the process. And rest assured, these feelings will pass. This is where you have to go into it with a positive mindset, because this is where you will let those feelings of depression, PTSD, trauma go. A lot of times you will face these during these ketamine treatments through your subconscious. Because today, our subconscious, there's only so much we can actually take in. But when you're confronted with these head on, it can be very scary. But you learn from them, and that's how you learn to move on from these thoughts. Now, real quick, once the infusion is over, you will likely still feel a little out of it as the ketamine wears off. You'll be monitored for around 20 to 30 minutes, and then you can leave. a loved one or a friend will give you a ride home because you will not be able to drive home. When you get home, rest if you can when you get home, and take advantage of your brain's ability to create new thoughts and habits. Journal, what was the experience like? If you start noticing, I want to try this, I want to try that, healthy things, go for it. That's the point of it. And then likely, if that was your first treatment, you will go back and you will start your second one, depending on how you respond. And even if it's very intense, which it probably will be, you still will want to go back to review with your psychiatrist how it went. But also, more importantly, even if it was intense and scary, the first infusion, think about how you're doing afterwards. So if your depression is clearing up and you're discovering new things about yourself, it's definitely worth going back in to go get that second treatment. The number one thing I've heard is people get scared during the first one. They freak out. They are like, I don't want to do this again. But then a couple days after that infusion, they realize my depression is gone. My depression is literally gone or improving, and I'm wanting to try new things. All right, so real quick, to sum it up, once again, a lot of insurances do cover ketamine infusion treatments, and it is something that is saving lives today. I am a huge advocate for it if your typical antidepressants do not work for you. And I'm a bigger advocate for it for not just major depressive disorder, but also, as stated, PTSD and anxiety. This was just a real quick summary of ketamine infusion therapy. I've gotten questions about it by actually multiple people, and I have a friend who has had it, and this is a video that was in a long time coming of me making, and I wanted to go and put it out there now. Once again, I love you all. The next video I will be covering is it'll be something in regards to psychedelics. I'm still kind of thinking, but there are some thoughts going through my mind on how I want to approach that video in an educational way. But look out for that sometime next week. But real quick, this is your daily dose of mental health. I love you all. This is all things mental health related, drug education, my own drug recovery, what I see in the psych setting, which I'll put videos out in that because I'm a psych RN. I'm going to be putting out all sorts, anything mental health. And if there's anything you want me to cover, put a comment down there and I can assure you I will get back to you, and I will put out a video as soon as I can. Once again, leave a comment, like, subscribe, hit that motherfucking bell icon. I love you all. Have a great rest of your weekend. I will see you again soon. This is your daily dose of mental health. Peace out.